the station working for you. This is WRTV News at 5:30, streaming now.
Now at 5:30, a high school program that can lead straight to a job. Hands-on experience as a student can help get young Hoosiers hired. And paying close attention to your health, a cardiologist shares the symptoms that you should not ignore to keep your heart healthy. Chris?
Topping our lineup, internet access has become even more essential during this pandemic, but a lot of older adults don't have it. The questions to ask to help get your older family members connected. A disproportionate number of women are still losing jobs during this pandemic. The possible solutions to prevent long-term damage. And eating disorders have been a concern. Now, they impact all of us, but some people of color may not be receiving the same level of care. The new effort to make getting treatment more inclusive.
Roughly from Terre Haute to Greencastle, Cloverdale, on to Indianapolis. This is the view. Light snow across central Indiana, especially the southern half of the state. That's the view. Let's see what it looks like on the radar. And a little heavier pocket of snow rolling right through just south of Franklin. That'll cross Edinburgh and I-65 in southeast Johnson County. This is what we're looking at here, coming along Interstate 70 from Greencastle and Cloverdale toward the metro area. And then from Bloomington to Nashville, these are just some light flurries to the north. That continues on toward Michigan and northwest Ohio. This will expand and really become the accumulating snow in the forecast through the nighttime tonight. The visibility, notice it drops to the south and west, 0.7 of a mile right now in Greencastle. That's a pocket of a little heavier snow. That's the biggest change in the short term. See changes in visibility across central Indiana. The probability of snow quite high this evening. Temperatures pretty much locked in place in the low to mid 20s.
Hiring Hoosiers is our mission at WRTV, connecting you to jobs and training programs for all careers. WRTV's Kelsey Anderson shows us how a program at Mount Vernon High School is getting students directly into high-demand jobs.
Well, now more than ever, the healthcare field is seeing a need for certified nursing assistants. And whether it be at a nursing home facility or with at-home care, they often say that CNAs are the first line of defense when it comes to recognizing the signs and symptoms of heart attack and stroke. And Mount Vernon High School is making it possible for their students to get a jump start in the field. The CNA program here at Mount Vernon allows students to take dual credit courses, get hands-on experience, and get certified so they can work at an assisted living center as soon as they complete the course. Kelly Harney is the co-founder of Hardin Educational Institute, and she says this is an important course and it allows students to make a good wage once they complete it.
You know, we talked about that students aren't, everybody's just not going to get that four-year degree at their traditional college. And so some people need to be able to work and have a gainful wage while obtaining their education. And so these programs allow them to continue as they want more certifications, as they have more trades, but to still be able to work, to assist with providing for their families, to take care of themselves, and continue their education.
We heard from senior Emily Rollo via email, and she says this class has been a good opportunity for her to test the waters and see if the medical field is right for her. And after high school, she does plan to pursue a career in nursing. So right now they have about 15 kids in the CNA program, and Vice Principal Stan Wilkinson says they hope that next year they see more enrollment, and they also hope that they can soon open it up to other schools in Hancock County. Working for you, Kelsey Anderson, WRTV.
Well, there's a lot of debate about how much and who should get a third round of direct payments from the government, but the back and forth on the issue may not be all that necessary.
It's rare when we have the cards set up to actually have a genuinely rapid economic recovery that could push unemployment really low in the next couple of years. I think that might happen. We should seize that opportunity.
Research Director Josh Bivens at the nonprofit Nonpartisan Economic Policy Institute advocates for the low and middle income. He says further targeting of direct payment checks isn't really necessary because no one rich is getting them to begin with. Now, he adds that narrowing them too much could leave out people who have had a pretty solid 2019, but a really rough 2020 since these payments are based on 2019 tax returns. According to Peter Peterson Foundation, the first payments provided a modest boost to the economy, but really only to certain industry like grocery or household supplies. People use them mostly for what they were intended for: food, covering rent or a mortgage, utilities, and regular bills. Critics have pointed out that higher income households that got payments saved the money or used it to pay down debt, but that doesn't bother Bivens at all.
Looking at the personal savings rate going up a lot in 2020 and saying, oh, we've wasted all those checks, that's really short-sighted. We know why the savings rate went up. It would be a great thing to enter an economic recovery with really strong household balance sheets rather than the really weak ones we entered after the housing bubble crash.
Now, Bivens argues that savings went up because there were fewer places to spend money last year. He also points out there should be other priorities over direct payments, like investing in beating and controlling the virus, unemployment insurance, food and low-income rental assistance, local and state government aid, and safely opening schools, because these aid packages are one-time deals. Now, he's not concerned about the cost.
Doing it one time and doing it when the economy is so weak that inflation and interest rates are just sitting in the basement, I'm just not really worried at all about that. I think if we talk about major new permanent expansions like Medicare for all, then you need to start to talk about raising taxes to pay for it.
Still ahead in our lineup, internet access has become even more essential during the pandemic, but a lot of older adults don't have it. The questions to ask to help get your older family members connected.
February is American Heart Month. Heart disease is the #1 cause of deaths for Americans. According to the American Heart Association, someone in the U.S. dies every 36 seconds to heart disease. Heart disease can cause weakness of the heart pumping function, things that can lead to congestive heart failure. It can mean a problem with the heart valve that is not opening correctly or leaking excessively. It can involve a problem with the heart's rhythm. But most commonly, what most people think of when they think of heart disease is coronary artery disease, blockages of heart arteries that feed the heart with blood, the kind of thing that can cause a heart attack. Dr. Scott Byers is a cardiologist at IU Health. He says symptoms and signs Hoosiers should look out for are chest discomfort, tightness, heaviness, pressure in the middle of the chest, shortness of breath. If things get harder to do, if you wear out quicker, sometimes it takes the form of palpitations, feeling like you are blacking out. Although heart disease can be genetic, Byers says it's not a death sentence.
Heart disease is very prevalent, but very treatable. There are lots of things that we can do not only to improve symptoms, but to improve prognosis. So for patients who have heart disease or are having symptoms that may reflect it, get checked out. I would also say that heart disease is preventable. It's worth knowing your numbers. There are things that we can do to prevent that first problem from occurring in the first place.
Dr. Byers says Hoosiers can make lifestyle changes starting today, whether you are healthy or not. Exercise at least 30 minutes a day, consume less alcohol, stop smoking, and eat a healthy diet. It is also very important to regularly see your doctor to control your blood sugar and cholesterol, treat high blood pressure, and maintain a healthy weight.
2 in 5 seniors do not have internet access. That translates to 20 million older adults in the U.S. These numbers come from Older Adults Technology Services, which is also known as OATS. Internet access has always been important, but it has become even more essential during the pandemic. Seniors are missing out on a lot of essential needs if they don't have the internet. Now, that can include things like online banking, ordering groceries, and socializing with friends and family. They may also be missing out on crucial information about the coronavirus vaccine.
A lot of people are wanting to sign up for the vaccines, and there is an absolute mess with a lot of older people that are trying to figure out the best way to get in and register, and virtually all those registrations are online.
Registering for the vaccine online is the quickest way to get in line, which may be a big incentive for a senior to get internet access. They may also want it for other reasons. Now, if you want to help out, first ask them what they want to do with the internet. That can help you find the appropriate tools for them to get online. Experts at OATS say that it is important that they have a large screen that's at least 11 inches. Using a smartphone just won't be very helpful.
We strongly recommend that people get a decent, stable wireline connection at home if they can. They don't need spectacular speeds. They don't need 100 gigabytes down or something like that. A basic consumer online connection is really critical.
Now, there are resources to help older adults with computer and internet skills. SeniorPlanet.org offers classes on the basics to specific things like banking and video chatting, and those classes are free. Well, we do have more to get to in our lineup. A disproportionate number of women are still losing their jobs during the pandemic. Possible solutions to prevent long-term damage. The CDC will put out guidance in the coming days about how schools can safely reopen. The CDC director says making sure community spread of COVID-19 is down is among the things we need to do. She's also said that teachers don't have to be vaccinated before schools can reopen. In a new interview with CBS, President Joe Biden said that we need fewer people in the classroom and reworked ventilation systems for safe reopenings. Now, with the push to get kids back into the classroom, some teachers are learning that in-person education is almost as difficult as being on Zoom. Chris Conti shares his conversation with some of our country's educators as part of our How Are You Doing series.
To understand what it is like to be a teacher in America right now is to spend a day inside Algonquin Regional High School.
I'm reflecting a lot on my instruction and what I teach.
Jane Bitar and Tom Alera are both English teachers. Between the two of them, they share more than 50 years experience.
I think it's stressful.
Stressful in the sense that it's so hard to try to do what we want to do for work.
But the hardest lessons this year aren't what students are learning, it's what they're experiencing.
It's not rewarding. Maybe because I don't feel that fun, like, connection with the kids as much as usual.
To help keep COVID out of the school, every room now has an air filter. Rooms are cleaned regularly. Masks are mandatory.
Usually I see kids sick and flus and everybody's coughing and sneezing. So this has got to be doing something.
Students here are working on a hybrid schedule. Half the class comes in one day, half the next, so that desks can be kept 6 feet apart, which isn't awful.
I appreciate the smaller classes. We're not working with 24 kids in a room, we're working with 12.
But the mask, the lack of interaction, that spontaneous part of education that teachers so love is missing.
I don't see any joy of adolescence. I really don't see it this year. It's so sad.
In-person learning is just different this year. Students can't sit together at lunch. Desks now dot the cafeteria, taking the place of communal tables. Teachers are concerned, not for themselves, but their students.
I'm worried that a little bit of that sort of lack of life and engagement and interaction that has dullified them a little bit, for some kids, I'm worried it's going to stick.
Like so many Americans, it's just hard for these two educators to find motivation some days. All that aside, though, they're grateful to be back in the classroom.
I think we're doing really well. I think we are working really hard, and we know that there is an end in sight.
At least you feel connected and you're part of the world.
And that might be the most important lesson anyone is learning this year. In Northborough, Massachusetts, I'm Chris Conti.
5:48:23 exactly. Whenever I'm in the studio, I take that opportunity to set my watch because the timing in here is impeccable. As you look at the east side, it's Washington Street. On the east side of Indianapolis, the ground a little wet there. We've had some snow showers and light snow move through. And let me show you what it looks like. Right on this northern edge is where the snow just shuts off, just north of Terre Haute to Greencastle to the north side of Indy. But south of that, that's where you have your best chance for a couple inches of snow, in some cases maybe 3 inches of snow in this advisory area. The rest of us, an inch or less as you go to the north. That's the advisory through 7 a.m. tomorrow morning. Watch for slick streets and changing visibility if you're driving this evening and early overnight. There are the darker blues with some little more intense snow bursts between 7 and 8. This will continue to drift a little bit to the north. That's why I think in Indy we could have inch to maybe an inch and a half, and there's some light snow for all of us in the early morning hours. Then that begins to pull away. Any snow left over in the morning will be fleeting and then gone. We'll hold on to cloud cover. Notice what doesn't happen. Temperature moves maybe a couple degrees. That's really it. Afternoon high temperature at 26. 38 is our average high. We've kind of lost track of that just because we're so below average. Look what returns Wednesday. More accumulating snow potential as temperatures sit in the lower 20s. Colder air than that, though, is on the horizon. Chris?
Scientists believe they've developed a way to treat skin cancer more efficiently and without surgery. Researchers at Yale developed an injection of nanoparticles in a chemotherapy agent that they go directly into the cancerous cells. Dr. Michael Girardi says that this breakthrough would allow doctors to treat multiple skin cancers at once. An injection treatment could benefit healthcare systems and lower the cost for patients. He says that one of the most important parts in this possible treatment is how it targets the skin cancer.
We load
the anti-cancer agent within. And that will slowly release over time. It keeps a lot of the anti-cancer drug right there within the skin cancer, so it can work long after the injection.
Now, work on the treatment started more than 3 years ago. Researchers wanted to develop a method that concentrated on its intended target, but is also compatible with treatments that stimulate the immune system. So far, they say the nanoparticles combined with the chemotherapy agent have been successful in clinical models.
You have a special coating on these particles that allows it to be very sticky. So when we put it into the tumor, it binds to proteins. That lets it stay within the tumor matrix, which is a complex of proteins around a cancer.
Now, the doctor says that the hope is that each skin cancer would need just one injection, but it could take more than one depending on the severity and the patient. Now, that is something that will be determined in those human trials. More than a year into this pandemic, women are among those continuing to struggle the most with returning to work. Alicia Nieves first reported on this troubling trend several months ago, and now shows us it has gotten worse. Today, she's looking at possible solutions to prevent long-term damage.
Women have historically struggled for equal pay and an equal place in the workforce. This pandemic may be exposing just how much of a struggle that is still.
I've been looking at this data for 10 years, and every time I open it in 2020, it's like, what's going to be, I just have no idea what to expect.
Jasmine Tucker is the director of research at the National Women's Law Center and has been following a troubling trend among women in the workforce. Every month since March 2020, the Bureau of Labor Statistics Employment Situation Report shows women have been disproportionately losing their jobs. The trend hit its height in December when the country saw a net loss of 140,000 jobs that month.
Men gained 16,000 jobs and women lost 156,000 jobs, which gave us that net 140,000 jobs lost. That was a big surprise.
Researchers like Tucker say the job loss is related to two factors. One, women having to leave the workforce to care for children at home.
If you have two earners and one has to stay home with a toddler, who's it going to be? It's going to be the lower earner.
The second reason for the disproportionate job loss, employers are simply letting go of more women.
Racism and sexism are alive and well in this country, and employers are making choices. This has real impacts, not just now, but in long term.
She says long term, women with gaps in employment will likely make even less than male counterparts and will see slower career growth. To tackle this issue, the National Women's Law Center and other organizations have been calling for Congress to invest billions of dollars in the child care industry, making it more affordable and accessible. And from employers directly,
we have to hold employers accountable. We have to hold their feet to the fire here.
I'm Alicia Nieves reporting.
Alicia, thank you. Now, finally in our lineup, eating disorders have been a concern during the pandemic, and they impact all of us. But some people of color may not be receiving the same level of care. The new effort to make getting treatment more inclusive. People of different races and in the LGBTQ communities may not be receiving the type of care they need for eating disorders. A new effort by the National Association of Anorexia Nervosa and Associated Disorders is working to change that. Now, to give you an idea of the problem, Black teenagers are 50% more likely than white teenagers to exhibit bulimic behavior. Gay men are 7 times more likely to report binge eating than heterosexual men, but they're not always getting diagnosed.
Which, can be even more traumatizing to someone who has already been traumatized as a result of their race or gender or sexual orientation, only to have a medical provider invalidate their concerns about their eating by saying that they must not have an eating disorder.
The association added demographic questions to its free helpline less than a month ago as part of its new initiative for inclusive care. So far, it's found 30% of callers to the helpline are non-white, 12% are gender non-conforming. But it did find when it surveyed people about care, responses included that they were the only Black person in the room at the treatment center and that their eating disorder was due to their racial trauma. Or they put that they're non-binary on their entrance form, but that wasn't addressed and they were assigned to a women-only group.
You need to have a more diverse staff so that a Black person seeking treatment in a treatment center is not the only person talking amongst a group of white people who simply cannot relate to what it must feel like to have microaggressions thrown at them on a daily basis.
Prioritizing diverse hiring is one of the new guidelines the association just developed for treatment centers. The guidelines also include having a client's personal pronouns in their electronic health record, having facilities that are accessible for people with disabilities and people in larger bodies, and using all gender restrooms. Treatment centers who meet these will receive a seal of approval. The Eating Disorders Helpline can direct you to those approved centers. Take a look at your screen right here. You see this number, 888-375-7767. Also, you can find support groups specifically for people of color, LGBTQ, and people in larger bodies at anad.org, and you can go to the Get Help tab. Well, these aren't the drones that you're used to seeing. These are police drones responding to actual emergency calls. Tomorrow, how one city says the drones are making policing safer and freeing up officers to respond faster to other situations.
Here's something you're used to feeling, that's for sure. cold. I've got that highlighted, and you say, well, I know that. Let me just point out, in the 7-day forecast, not a single day reaches 30 degrees, and this takes us through the 22nd of February. That's all for the news at 5:30. Back to covering snow.